Well, hello there. I am Dr. Shapi, a general surgeon registrar, and today I'd like to talk to you about hepatocellular carcinoma, also known as liver cancer. So, just as the name suggests, hepatocellular carcinoma is basically cancer of the liver. The cells in the liver are known as hepatocytes. So, these hepatocytes, when they grow uncontrollably and rapidly, they become a tumor and ultimately becoming a cancer. Statistically, hepatocellular carcinoma accounts for about 400,000 deaths annually, and about 500,000 people are diagnosed with hepatocellular carcinoma annually. Risk factors for hepatocellular carcinoma are quite a number. The most important include, number one, alcohol misuse. So misuse of alcohol causes liver injury, which results in what we call liver cirrhosis, where the liver becomes fibrotic and it's filled with a lot of fibrotic tissue. Another risk factor for hepatocellular carcinoma is environmental. What do I mean by environmental? Exposure to certain toxins. There is a toxin known as aflatoxin. This aflatoxin is a fungus that is found in a lot more of peanuts. So eating too much of groundnuts is a risk factor for hepatocellular carcinoma. The other important risk factor is suffering from hepatitis. Hepatitis causes some changes in the liver that predispose an individual to hepatocellular carcinoma. Symptoms of hepatocellular carcinoma are also quite a number. These include, the most important one is jaundice, which is the yellowing of the skin and the eyes. Another symptom is persistent pain in your abdomen on your right upper side. Another symptom can be abdominal distension. There is also the symptom of swelling of your legs or generally your whole body as a result of fluid accumulation or edema. Other symptoms may now include unwanted weight loss, where you are losing weight unintentionally, and then nausea, vomiting, fevers, etc. Investigations for hepatocellular carcinoma include a variety of tests. Of course, to diagnose a cancer, we have to do a biopsy, but other imaging studies take predominant role in diagnosis of hepatocellular carcinoma. These include a CT scan, an abdominal ultrasound scan, and the most important, an MRI scan. Management of hepatocellular carcinoma depends on the stage at which the patient presents to the healthcare facility. Like I always say, the earlier the diagnosis, the better the prognosis. However, management strategies include surgery, systemic therapy, and the administration of some chemotherapeutic drugs. So therefore, what is important is how can one prevent themselves from suffering from hepatocellular carcinoma? You work on the risk factors that I mentioned: misuse of alcohol, proper consumption of peanuts, and vaccination against the hepatitis virus. And then the other important thing is, when one notices any of the symptoms that I have mentioned in this discussion, they can quickly come to the hospital for further screening and testing. Some tests that can be done are the imaging tests that I mentioned earlier, the CT scan, ultrasound, MRI, and a blood test known as an alpha-fetoprotein. That being said, thank you for joining me on this one, and see you on the next one.